We've reacted to rescues on the beach, sporting events, but how about real life rescues by paramedics, EMS, ER workers in Australia? It's a legitimate TV show called Emergency. Let's check it out.
So we know that there's a man who's coming in police custody, who's been stabbed on the left-hand side of his body.
That's really dangerous for two reasons. One, for the patient, anytime you've been stabbed, especially if you've been stabbed and the object has been removed, you're gonna have a lot of bleeding. You don't know where the bleeding is coming from. You need to stabilize the patient very quickly. 2 large bore IVs, fluids, blood, all that stuff is happening. But because it was a violent episode, you don't know if that patient's gonna be uncontrollable. And 2, if there's gonna be someone coming in from whoever that person was fighting to quote unquote finish the job or continue that fight. So sometimes there's this retaliation thing that happens in hospitals. So you have to be aware of that and you have to let security know.
The man is under the influence of alcohol. He's extremely agitated and police are standing by.
This is not unusual. This happened all the time on my Brooklyn, New Jersey night shifts. And a lot of times, if they had a trauma, sometimes it was on their hands, they'd be moving it all around the room, just shooting blood everywhere. So everyone's fully gowned up, masks, the whole 9, because you have to also think about your protection.
He says you're stabbed twice.
It looks like they're about to do a portable chest x-ray there.
Not sure where it happened. Went home, difficult to assess the depth of his wounds. He's reluctant to stay close to it. He's got significant thoracic pain.
That's not good. It sounds like he got hit in the lungs. He probably has a collapsed lung.
Maddie, I want to let you know why I want to lay you down. Because the ultrasound only works if you're laying flat.
Give me the morphine.
I'll give you the morphine, and then what I'm going to promise you,
Water, please, mate.
I'm going to get you something to suck on in your mouth.
Drink, please.
So they could easily pull out all those tubes, all those IVs. And remember, giving a lot of morphine can decrease the respiratory drive and make the problem even worse. So you have to be careful which medicines you're choosing for a patient like this.
I reckon you've been stabbed in the belly, and I reckon it's popped into your tummy, and I reckon it's bleeding. You'll get sick and die if you don't have an operation.
It's really great communication by the doctor because getting the patient on board with their own care, even when they're in a obtunded state like this, is very valuable.
I'm giving you some medication through the drip, okay? It's called ketamine.
They're knocking him out.
This man needs sedation and he needs a drug that won't affect his blood pressure and heart rate. So I've given ketamine. I've gained control of the situation now, but I get the feeling that I can't just relax.
See, this is where you got to think about your own protection here.
Down like it.
So I need you to hold him down.
This looks very violent, but again, it's in the patient's best interest. Otherwise, you're giving medications that could potentially end his life. Because again, you don't know how severe this bleeding is.
So I'm going to give him a couple of milligrams of Medaz. I think he's having emergence reaction from the ketamine.
She's giving him basically a version of Xanax, just a shorter acting in order to help calm him down. But again, has an impact on the respiratory drive, so you gotta be careful about that.
It's taken 6 security staff and police to restrain the aggressive man. In order to keep the man unconscious, Dr. Emma decides to take over his breathing and put him into an induced coma.
Yeah, that's wise. You just gotta be very careful. If the stab wound did hit the lung and now you're putting air in there, you could be making the problem worse. So you just gotta evaluate the situation as it goes.
I was trying to meet him and talk to him so that maybe he felt that he had an ally, but his brain wasn't working that way because drugs, alcohol, and
blood loss. Blood loss can make you act this way.
With the patient now under control, Emma's job is done.
I mean, her job is done because her job is to stabilize and make the initial diagnosis of the patient and then send them to trauma surgery in order to get that wound closed. And it's not so much the wound that's closed, it's whatever's bleeding inside that wound. The superficial wound is kind of whatever.
He was rushed to surgery where the internal bleeding was stopped and his stomach repaired.
I wonder if it actually went into his stomach, or are they saying stomach like belly? They literally have to go through the bowels when they do a surgery like this to make sure none of the bowel is damaged. It's called running the bowel.
23-year-old Zach has been in a horror workplace accident where his right hand got trapped in factory machinery.
Oh. He does not look well, or he's on some serious pain meds.
The glove of his pinky finger got caught in the rolling machine. Then he felt his hand go up and under.
Oh, did it just get mashed through the machinery?
He says that his fifth finger was completely amputated. The other two are completely degloved down to the bone.
Oh, degloving injury, the most brutal injury to visualize. Oh, man.
I don't know if my pinky's gone.
Your mates put it all in a bag for us.
Oh, that's great. Remember that if you lose body parts, putting them in a bag, not necessarily touching ice, but in some kind of wet paper towel maybe, and then resting near ice is not a bad idea.
Zachary reacted pretty quickly. He put his feet up against the side of the machine, just pushed hard, pulled himself out, which was a life-saving decision.
You've done well. You've saved your own life there.
Yeah, if it went higher up, once the larger arteries, the brachial artery starts getting cut, you're bleeding out and dying very quickly.
What are the chances of me keeping my fingers?
I mean, it's
Pretty low.
It'll be a lot of operation,
Yeah.
if I'm to be honest, okay? And in terms of what we have to do, in terms of functionality after all the operation, it's going to be very... It'll take a lot of rehab to get to...
Rehab, and you don't know how that rehab will go, but I like the way the doctor's talking to him about this. Again, very specialized doctor, hand surgeon ideally. Shout out to all my OTs, PTs out there. They're gonna help him do this rehab.
Take the piece of skin and see if we can find some arteries and veins within it to put back up to yours. Given the mechanism, it's probably unlikely we'll be able to do that when they get ripped. And if we can't do that, we actually just make a little pocket in your tummy skin.
Is he gonna get a stomach pocket?
Bury your fingers in that and leave that there for 2 or 3 weeks, then gradually divide fingers at a time.
True. That sounds cool.
Yeah, this stomach flap actually works to bring circulation to his healing tissue, and his healing tissue is going to be screaming, basically asking for more blood vessel support because it's not getting enough oxygen. And you're going to have this process called neovascularization happening, where all these different mechanisms, the VEGF, all of these factors are going to be coming into play in order to create new blood vessels. And then once they have been created, you could free the hand and allow it to sustain life on its own.
So they reattached my pinky, put the skin back on and all the flesh, just hoping that it would take. They took some veins from my foot to help get blood flow. I can't remember how many days after, maybe 4 or 5, they did another surgery.
Think about how important the hand is, that they're taking veins from the foot, from the damaged tissue, the stomach. Like, we're doing anything we can to save this hand.
All the flesh had died practically, so they've stripped it all back to bone again and put it inside of my groin.
Yeah, so we either do this in the abdomen or the groin. The issue, obviously, is because you're keeping it locked in there, it requires a lot of rehab as the joints become very, very stiff from lack of motion. Even the shoulder starts feeling that impact.
It's pretty crazy what they can do with medicine. They're gonna grow my fingers back.
We're not literally growing fingers back. I just want to put that out there. We are creating new blood vessels to allow that area to heal.
We're expecting a young female in her early 30s who's apparently been bitten by a snake.
I could have sworn he said he got beaten by a snake, but I guess bitten also works.
She's reporting a headache with some vomiting and feeling generally unwell, which might be a sign that she's been poisoned.
I don't know much about snake venom, but I do know that I was about to say, brown snake antivenom. There's a lot of antivenom that exists in Australia because of these poisonous snakes. There are unique things that surround venom that are quite interesting because of the way that it's manufactured. I'm gonna see if they're gonna get into that.
Brown snake antivenom.
Do we have tiger as well?
Yeah.
How do they know what snake it is? Is it based on symptoms or based on the description the patient gives them?
We probably won't know, and in all likelihood, we'll probably have to give one brown, one tiger.
Yeah.
Both brown and tiger snakes are potentially fatal. They're amongst the most poisonous snakes in the world. Both of those can cause a patient to bleed and bleed very quickly and in places where we can't stop the bleeding.
Yeah, so a lot of this antivenom is made from animals, sometimes horses, I believe sometimes sheep. And in doing this, it creates animal antibodies that are also present, different proteins that when you give it to a human, and even when you give it in the right dose, you could have an early reaction, that's like an allergic reaction, anaphylaxis, but then there's these types of delayed hypersensitivity reactions where these immune complexes from the animal proteins and the human proteins that are attacking them start creating this massive immune response. And really the mechanism to treat this is not really to treat, it's to prevent it. Using antivenom that they try their best to purify or use less of in order to decrease the chances of this type of reaction.
So Ree's out running today. She ran about 6Ks. She was looking at her phone and has stepped onto a brown snake and it's bitten her on the back of her right leg. She has had considerable pain in her right calf and has required 250 mics of IV fentanyl.
That's a lot of fentanyl, wow.
Calling on her paramedic skills, Ree used her running gear as a bandage to slow down the venom seeping into her bloodstream.
I don't know how much time that actually brought her, but I guess good thinking.
With the antivenom itself, there's a risk of something called serum sickness.
That's what we were just discussing.
Any sort of immediate allergic reactions ranging from rash to anaphylaxis. I think being a paramedic and having almost certainly seen her fair share of anaphylactic reactions in the past, I'm sure this information's quite unsettling to Ree.
And it's not about just giving some like antihistamine to prevent this, because this is not the typical allergic mild histamine response. This is immune complexes and it's different, and that's why it takes time to develop.
If I was in her shoes, I'd be terrified. There's the antivenom for tiger snake and there's an antivenom for brown snake.
I'm surprised they're giving both because that increases the chance of serum sickness.
And we run that over 30 minutes and that should neutralize any of the toxin that's been absorbed into the bloodstream. Excellent. All right, we should hopefully have some bloods to check now. Yes, they're all back. Her D-dimer's negative and her coags are normal.
So does that mean it didn't work, that the venom didn't even get put into her body?
Got some good news for you. Blood tests all normal, so no signs of any bleeding disorder. We'll need to repeat your blood test.
Oh, there it is.
Okay. It's certainly not oozy, and you can still wiggle your toes, all right? Yeah, beautiful.
It seems like the antivenom worked, and yeah, it's insane. I'm still getting over the fact I stepped on a snake yesterday.
I know that it's possible for a snake to dry bite, so maybe it didn't let the venom go.
Emergency services.
My daughter's, she's suffering pretty bad from asthma panic attack and...
Asthma or panic attack or both? Because when someone is having a panic attack, it could feel like they can't catch a breath, like their heart is racing, they're experiencing palpitations, but it might not actually be physiologically an asthma attack where you're having bronchospasm, the airways are constricting, there's inflammation in the airways. So the mechanism by which all this is happening is really important because that's gonna guide treatment.
Okay, is she breathing?
Yes.
Is she still awake then?
Oh, she's she's collapsing.
You need to get help there stat to figure out if this is an asthma attack, to ideally get her intubated to help support her breathing. Because for all we know, she could be having anaphylactic shock. She could have consumed something that's created an allergy in her airways swelling.
The caller's daughter is having an asthma attack so severe, she urgently needs help from a mobile intensive care ambulance.
Oh, she's got purple.
Purple is a really bad sign. That's likely meaning she's experiencing cyanosis, not enough oxygen reaching the superficial skin. Therefore, you have this discoloration, rapid discoloration.
Okay, I'm going to tell you how to give mouth to mouth.
I don't know if mouth to mouth would do anything here. I just don't know if that's going to be helpful. Usually we keep mouth to mouth for situations where someone has been without oxygen for an extended period of time. I don't know how long this has been ongoing. I perhaps would have just led with chest compressions only at that point.
Another crew has already arrived on the scene and radios through with news.
Patient's pre-arrest, currently respiratory asthmatic arrest.
Give it adrenaline, kids, give it adrenaline.
What did she say? Give her adrenaline? That's an unusual thing to say.
Kelly, open your eyes for me, darling. Open your eyes for me.
I see that she's unconscious, she's sweaty and she's blue and she's not moving much here at all. And I know that she's knocking on death's door.
Yeah, so you got to get her intubated. If you can't do it there, perhaps you could do it from the neck. I don't know if they could do that in the field.
In a desperate attempt to open her airways, Paramedics Karina and Mark are now pumping adrenaline directly into her veins.
I don't understand. Is she having an anaphylactic attack? All right, I had to stop the video and look this up for myself because I'm not obviously familiar with respiratory pre-arrest asthma guidelines in the field. But in this case, even though it's not anaphylaxis related, you still want to use epinephrine, but very late stage. And I'm assuming that's why this is very late stage. The idea is that epinephrine is not better than beta agonists like the albuterol we all think of for asthma. But in a scenario like this, where the inhaled beta agonist is not reaching the lower airways because there's so much constriction there, you want to give a medication through the IV in order to reach that area, at least through the circulation. Now, there are obviously way more side effects, which is why we don't prefer to use it. And it's a high risk, late stage potential medicine. After the albuterol, ipratropium, even magnesium is a late stage add-on that you could use for refractory status asthmaticus.
Kelly will be placed in a coma, so oxygen can be pumped directly into her lungs.
You have to do it in a very specific protocolized manner to make sure that you are not overinflating the lungs, potentially damaging the lungs.
To make way for the breathing tube, an instrument known as a bougie is used.
You have to be very careful because it's very easy to break the patient's teeth in a scenario like that.
Just so everyone is aware, she's now long-term paralysed with pancuronium, all right? So maintenance of this tube is critical. So if there's a risk, I'll just yell out straight away and we all stop immediately, all right?
So stop at any point, we stop.
Just say stop.
Because she's not hooked up to the machine yet, he's still breathing for her just with the help of that ET tube.
Kelly has now been fighting for life for nearly 2 hours.
Wow.
After 3 days in a coma, and against all odds, Kelly has made a complete recovery.
Wow, that's so scary. I mean, in the hospital, we see this play out where patients who are experiencing a severe asthma attack start to deteriorate in a way where they start developing less wheezing in their chest. So young residents, med students will come in and say, they're doing great because I don't hear any wheezing anymore. But that could actually be because there's no more air moving at all. So you don't just listen, you also have to look and examine the patient, look at their numbers, look at their O2 stats, do some peak flow testing. There's many variables you have to look at, not just listening to the chest.
A frantic mum is on the line.
Tell me exactly what happened.
My little boy pulled a hot cup of coffee on him and it seems to
Oh, I'm worried about third-degree burns.
What part of the body was scalded?
on his face and down his arm and his chest.
Oh, no.
Is that him screaming?
Yeah, that's him.
Oh, poor love.
So it's really dangerous to have that level of burns, especially surrounding the mouth, because that can create swelling in the airway, makes it very difficult to breathe. So sometimes patients like this need to be sedated and intubated. Also, babies, we follow these rules, calculating and estimating how much body surface area has been burned to decide what the course of treatment should be. And it's very important that we realize that a baby's numbers are not the same as adults as visualized on this chart.
It's really tough hearing a child in such excruciating amounts of pain. My heart is beating at a million miles
That's so
an hour.
sad.
How emotional and distressing the scene is.
Oh no, there's so much scarring around the mouth. Oh, I'm worried about the immune reaction that's gonna happen right now.
It may look a little strange, but in fact, the best dressing that we can apply in ambulance for burns is cling wrap. It prevents ongoing fluid and heat loss from the burn, therefore reducing the likelihood of hypothermia. It's also got a role to play in preventing infection from the burn.
Oh no, his lips are actually okay.
So the volume of morphine I'm actually drawing up for Jackson is minuscule. It's actually only 0.12 of a mil.
When you do that, you have to make sure that you dilute it with some fluids in order to actually get that volume in there, because it's very easy for it just to get stuck in the needle and a little bit of it in the syringe, and you think you give it, but nothing actually came out. That's why if you draw some extra fluid in with the medicine, you're able to deliver that dose a lot more effectively.
And it's been 5 weeks since Mark was called out to rescue 19-month-old Jackson.
Ah, he healed up so well.
Hard to believe this happy little boy suffered burns to his face.
See, they had to sedate him and probably intubate him. Those are pretty severe burns.
And spent 3 days in an induced coma.
Hey kids, a couple of teddies for you from the ambulance. How you going, Jackson? How you feeling, mate?
Say hi.
Really shy.
He looks well, doesn't he?
Yeah, he does. He's back to his happy normal self.
The severity of his injury was not so much that it was a 3rd-degree burn, but more so because of the amount of surface area that the burn covered. Again, it impacts your ability to control temperature, fluid losses, infection risk. So it's like risk. That's why there are dedicated burn units in hospitals to take care of these patients, as they need to be incredibly specialized.
RC710. This male's been kicked in the face by a horse.
Oh no!
A young horse trainer has been seriously hurt at a stable in Melbourne's outer southeast.
I mean, right away you're worried about facial fractures, bleeding extensively, obviously brain health, concussive injuries. If the spine gets severed in a high enough area, that's instant death.
He's just lost consciousness. He's in and out real bad.
That could be as a result of the concussion, the brain damage, could be the result of fluid losses, blood losses, could be the result of a vasovagal injury. Just from seeing so much blood, you could pass out.
His brain's been shaken around. There's a possibility he's got bruising or bleeding. And also, he might have a spinal injury.
Yeah, the spinal injury is what I'm very worried about. I hope they secure his neck at least with a soft or a C-spine collar.
His jaw is clearly fractured and dislocated. His face is smashed in. He's already got airway swelling, and I'm concerned that it will close over and he won't be able to breathe.
Oh! We're just going to put some morphine on board now, okay?
I wonder if this is how Jake Paul felt after his last boxing match. I'm not even saying that jokingly. Jake Paul had a double jaw fracture. Like, imagine the strength of Joshua's punch. That's like horse level strength.
Ideally, I would put a collar on Nathan.
I would definitely put a collar on Nathan.
But he's got swelling, and if somehow that pressure of the collar moves his jaw and compromises his airway, then we're really in trouble.
I mean, I guess if you really think his cervical spine is safe, but maybe you could put a soft collar on at the very least to give him some support.
The journey to the Alfred Hospital's trauma centre in Melbourne can take over half an hour.
It's great that they're holding his head like that. That's a good secondary support.
Good gear.
Horse trainer Nathan is now back at home with his pregnant partner Michelle.
Look, we're nearly on 8 weeks now since the operation. The extent of the injuries was broken nose, shattered cheekbone.
Oh, he got a zygomatic arch fracture.
Broken eye socket.
Eye socket fractures can be really dangerous because some muscles can actually attach to those areas and then the eye doesn't move well.
And inserted 5 plates all the way around my face, down through the nose or like the nasal passage and down through the cheekbone to repair it all. Good man.
And he still works with horses.
I never thought about quitting. You know, I'll be going out on my own terms, but from a kick to there, that's for sure.
I would have loved for them to show his CAT scan. I'm sure it would be quite disorienting. Disorienting? I actually played Never Have I Ever with a firefighter. Click here to check that out, and as always, stay happy and healthy.